We're the Louisiana State Medical Society, and we advocate for patients and their doctors. The issues we have now are reimbursement so that we can afford to keep our offices open and provide the care for our patients. We're frustrated with a lot of difficulties in terms of the healthcare dollar. Doctors only really spend about 13 out of every 100 healthcare dollars, and yet we get blamed for virtually all of the healthcare expenses. It's our job to continue to be able to give access to care to all patients, while at the same time having many patients who are unable to provide the adequate reimbursement it takes to keep the doors open.
There's several major issues that we're dealing with. Locally here, I think one of the major issues we're going to have to deal with is tort reform. We need to look at setting up a mechanism to allow the legislature to set the malpractice cap. We cannot depend on a single court decision that could dramatically change the way we practice health care in the state of Louisiana and that could chase the best and brightest out of the state.
The medical malpractice issue and the challenges to the cap. There are a couple of challenges to the cap that are winding their way, and actually there's one, I believe, now in the state Supreme Court. And if the cap gets overturned, then malpractice premiums are going to soar. And if that happens, the physicians will leave the state and we'll have a physician shortage like we did potentially have a physician shortage in the 1970s when the cap was first passed. I believe it's important that physicians know about that and get involved and become familiar with the issue, because it requires a legislative fix. And the only way that we're going to be able to resolve it is to have physicians getting to know the legislators, going to the legislature, and coming up with a solution to the challenge to the cap.
Explain what the cap is and how it works.
The cap is the limitation of liability that physicians have in medical malpractice actions, and there are actually two layers. The first layer is a $100,000 layer that is covered by the insurance that physicians buy or the self-insurance that they provide for themselves. And then the second layer is the patient's compensation fund, and that goes from $100,000 to $500,000, and that's when physicians contribute a premium to the patient's compensation fund for participation. So the overall cap is $500,000 with a couple of exclusions. Future medical expenses are excluded, and judicial interest is excluded from the cap. But except for those two items, everything else is included in the cap. Now, if the cap is overturned, if it's found unconstitutional, then potentially the liability is unlimited. And what that means is physicians potentially could lose their livelihood, they could lose their property, and their physicians who are in high-risk specialties are not going to want to practice in the state. We live in a very litigious state. We have a litigious population, and because of that, there's great risk. So we really need to get involved. We really need to be up in the legislature. Physicians need to know their legislators. They need to talk with them on a regular basis. They need to communicate with them, and that's the way that we're going to be able to solve this problem.
The Louisiana laws have been in force for approximately 35 years, and they're now being challenged because of cases out of the Third Circuit Court of Appeals, and they are being now heard and presented to the Louisiana Supreme Court. These run the risk of challenging and destroying the current act.
And what would that mean for physicians and patients?
If we don't plan for this and we don't set up a system that is responsive in a timely fashion, we run the risk of having the unaffordability of malpractice insurance and the loss of providers in this community.
If the Supreme Court finds the current cap unconstitutional for whatever reason, the legislature can then draft a law. They can do a couple of things. They can create a new cap that would hopefully the Supreme Court would find constitutional, and by the way, the Supreme Court has found the cap constitutional a couple of times already. Or they could also pass a constitutional amendment, which would then go to the voters of the state that would say that the cap is constitutional. So there are a couple of things that the legislature could do.
At the federal level, we're going to have to look at several issues in terms of health care reform, issues from decreasing access caused by reductions in the sustainable growth rate formula, to the increasing mandates on both time and energy that are being put on physicians by the federal government and the recent legislative changes. So those are all issues that the Medical Society is going to be very active in and very involved in. We're monitoring these closely.
It's a very exciting time for healthcare in Louisiana. We have two major initiatives that are coming online, first in February and then in March. We're switching our Medicaid program from fee-for-service to managed care. Through that, we have greater emphasis on wellness and prevention and coordinating those with chronic disease and those, say, that are pregnant to have the best outcomes possible. At the same time, on March 1st, we're implementing a program called the Louisiana Behavioral Health Partnership. So we integrate and coordinate all of our mental and behavioral health services under one umbrella so people can access them more easily, and we have the ability to refer people to the proper service at the right time in the right place.
And what is this going to mean for physicians around the state?
Physicians will have more assets with which to work. So, for example, for a primary care physician, we'll have access to a greater array of specialists for their patients. In the world of behavioral health, there'll be more ways to refer out, whether you're in a hospital or in an outpatient clinic, to get the kind of care and services that you need to take care of the patients in a very cost-effective and efficient way to bring health outcomes up across the board.
Many of the physicians in Louisiana are concerned about reimbursement rates. What's the outlook there?
For reimbursement rates, they're the same as they are in Medicaid, so there should be no material change. Some health plans are working with physicians to add bonuses on, and for that, when we see higher health outcomes, better quality of care, and also keeping costs down, physicians will be able to receive bonuses for doing and stepping up to services like that.
I'm a pediatrician, and 80 to 90% of my patients have Medicaid as their funding source for their medical care. So anything that affects Medicaid affects me directly. So the issue right now is with the changes of Medicaid, the whole way of doing business for the last 30, 35 years is going to change, and no one seems to know the answers as to what those changes are going to mean for an individual physician.
What about the reimbursement rate? What kind of an impact does that have on you?
Well, reimbursement rates for Medicaid have traditionally been low. They're enough probably to survive if you have other sources of income like private patients that you can supplement them with. But the reimbursements are adequate to at least survive. The concern is that with the advent of the Bayou Health plans, 20% of the money that was going to be used for patient care is now going to be given to the insurance plans as administrative costs, which means the care that we used to give for the patients, we're going to have to give the same care with 80% fewer dollars covering that care. Those 20% are being shifted over to administrative costs.
We're facing a problem with access to care for Medicaid patients, specifically access to specialists. Regarding reimbursement rates, those specialists won't see Medicaid patients because of the low reimbursement rates from the state Medicaid program.
What kind of a problem does that cause for everybody?
Well, it's a problem for the primary care physicians. Their patients can't be seen for specialty care. It's a long wait time at the state-run charity hospitals to get those patients to see a specialist. There's a lack of specialists to see those patients, and they're only in one or two areas of the state, New Orleans and Shreveport.
What would you like to see happen?
Well, I would like to see the changes in the Medicaid program to continue to expand access to care for all specialties, and the biggest way and the easiest way to do that is to make reimbursement rates more competitive.
Physicians are facing how do we provide care for our patients, the citizens of our state. That's what we're very interested in. And we look at government impacts and non-government impacts. So on our elderly, we're very concerned about Medicare, what's going to happen in the future. We passed this law, Accountable Care Act, a few years ago. We're all learning what this is becoming, and we're all uncertain exactly what it is. On the younger side, we have Medicaid. It helps our women and young children, and that is changing. We're having Bayou Health come on board, a new entity. It's new, it's unknown. We don't know exactly how it's going to develop over the next few years, but everyone is hoping for both of those ends to be successful. Then we have the group in the middle. This is the commercial people that actually work and have a commercial insurance. They're not Medicare, they're not Medicaid. Well, exactly what happens to them? Do they have a future in the state? Do they have a future in the United States? All of that impacts the people that we want to provide services for. We want to be able to have access to our patients, and they have access to us. And these insurance companies, both government and non-government, provide a means to that access.
As a pediatrician, several things have impacted my practice lately. First of all, we're told I have a lot of regulations that we have to follow, which takes me away from taking care of my patients and worried about more following the rules, when I can spend more time with my patients. In Louisiana recently, for the Medicaid population, they've switched over to try to privatize it to see the community care network. And because it's right now very unclear how that's going to work, and it's going to be even harder for us to be able to get our reimbursement for the patients that we see and to know the system. Other things that are coming down regulation-wise for us is that we have to now convert in my office to electronic medical records. And although in the long run I think that's going to be beneficial, because it'll have some records of my patients, and such as when we had a catastrophe for Katrina, those records got lost for many doctors.
We have discussed the idea for people to have choice, for people to be able to help choose their doctor, and that they are in charge of their own health future. And then the government people support that. And we want them to have portability. Just like we learned in a hurricane, when my car, I had to drive to another state for the hurricane. If I was in an accident, my car insurance came with me. We want the same thing in health insurance. We want people to travel wherever they are, and their health insurance follows them, whether it's a government or a non-government.
Medicine, I think, right now is in an extreme crossroad. We are being regulated more so than any other professional organization in the world, and we're being told what we can do, when we can do it, what we will be paid to do it, and then in the press they claim, and we have an ever increasing number of patients with ever decreasing remuneration, and people screaming that we don't have enough time to spend with each of them, but yet we don't have any opportunity to have input in the process. The federal government has decided that one of the areas that they're going to cut is health care.
The biggest challenge that we face is protecting our profession. We all went to medical school so that we could deliver the highest level of health care. And to maintain that, we must constantly fight different practitioners who are trying to get basically a piece of the pie. It's also imperative that we demand that high quality to protect our patients.
I think we can summarize the problems that current doctors are experiencing now with just uncomplicating patient care. Right now there are a lot of barriers that have been put between the doctor and his or her patient that make the practice of medicine much more complicated than it is. And what it is happening is that we are spending time and effort in doing things that are not directly related to treating the patient and ensuring good outcomes. And that is excessive regulation, that is having to deal with how to take care of the uninsured, that also will mean in the future how to adjust to these coming changes of pay for performance. So the challenges to the current practicing physician are multiple, and it is very important that we remain together, that we have a position and we defend that position. That is only accomplishable through organized medicine.
I practice medicine in rural health clinics, and I would like to see the government have a better coverage for clinics and not to close any of the clinics at this point that are taking care of the uninsured or the patients that do not have access of care.